afternoon and thanks for joining us. I'm Judy Simpson. Today we continue our occasional series of programs on your health and cancer. In partnership with University of Vermont Cancer Center, our focus this afternoon is on integrative medicine and cancer care. You're not alone if you're hearing the phrase integrative health care for the first time. To find out more, I'm joined by two guests. Dr. Amy Littlefield owns and operates Vermont Wellness Medicine and Integrative Oncology. She is one of 4 oncology certified neuropathic physicians in New England. Her work in cancer care bridges the gap between conventional medical care, and naturopathic medicine by working with patients and medical providers around the state. Along with Dr. Littlefield is Kara Feldman-Hunt. Kara manages UVM's integrative healthcare program. Her work involves collaborations in the academic study and clinical application of integrative medicine. Thank you both for coming in. My first question, Kara, is what is integrative healthcare?
So it's the combination of conventional medicine and alternative medicine. It's really the best of both worlds. The approach is to have a relationship between the practitioner and the patient. It uses the least invasive approaches first when possible. It's really about health promotion rather than disease management. And anything else that you would add that I've missed? Does that cover it?
Mm-hmm.
Yeah.
Mm-hmm. And so what's the difference between integrative healthcare and alternative medicine?
So that's a really important question because there are lots of ways to support your health. And sometimes people think of alternative medicine as something they might choose instead of the standard of care, conventional oncology. That's a really important distinction that I like to make because an alternative suggests that there's an equivalent option. And in oncology care, there really isn't an equivalent option that will give you the same benefits that you could get from standard of care conventional oncology. So what I advocate for in my practice is to combine the best of both worlds. Take what we know from that's very useful in the complementary therapies and combine it with conventional standard of care in a way to improve outcomes and quality of life.
That sounds pretty unique.
It's a growing field. It's absolutely a growing field, but it's getting much more common because patients are asking for it, doctors realize the value. And so there are a group of us in the area who are really promoting this access because it allows patients to stay involved in their care.
And so that would mean that probably every patient is clearly different as far as what their needs are.
Yes, absolutely. So when I work with a patient, I will get to know very much about their conventional care. I'll get to know their current treatment, their past history, and their side effects of treatment and what their personal medical goals are. And then the really important thing that I do as part of my practice is make sure that we take out any treatments or therapies they've chosen that are not compatible with their current conventional care. And there are dangerous treatments out there. So we guide them and we help them. And then from there we build and we say, what can we do to help your sleep be better so that your overall outcomes are better? How can we help optimize exercise? How can we optimize your nutritional choices? And then some patients want to do even more. And then I help guide them through the safe choices in terms of supplements or additional proactive therapies that they might choose to do, keeping in mind always what conventional care are they getting? Are these two compatible, or do we need to keep them apart and pursue an alternative that is safe and compatible?
And so do you have patients that are very much on board with this, or are there patients that are a little intimidated by this?
Anyone who comes to see me is seeing me because they want to pursue a more broad, integrative, holistic type approach. And they're coming to see me either because they want reassurance that they're doing it correctly, or their physician has recommended that they get an opinion on how to do it safely. But everyone who comes to see me is usually pretty proactive in their own care and is looking for medical guidance. Am I doing this correctly? Are these choices the right priorities for me? And collaborating with the conventional team is really important on that as well.
And so when conventional treatment ends and patients ask what's next, is that something you can help with as well?
It's one of the most fulfilling parts of my practice because patients will go through this very emotionally, mentally, and physically demanding treatment, receive the news that they're cancer-free, let's say, and also feel that they want to be really proactive. And we absolutely know with the growing field of integrative medicine research that there are more things that are available to them if they choose. And we can optimize and hit the targets for what the best application of exercise is and getting them stronger and rehabilitated physically, we can absolutely hit the targets for how many vegetables should you really eat, and how much does that matter? And patients come to me all the time feeling burdened by the rules and the information they find online, and really appreciating having some good integrative medical guidance on these questions that kind of bother them when they're looking to take a role in their own care.
Because, of course, now with the internet, there is so much information right at your fingertips, and it's really hard to kind of wade through all of that.
Absolutely.
And so are conventional providers really appreciative or well-informed on different options that are available?
That is growing. Certainly there are providers who know more, and some that are still learning. I think UVM is doing a great job of working to make that accessible to their providers. I know across the board that when a provider has good information and is open to communicating, the providers, conventional providers, appreciate that. There certainly exists some alternative practitioners out there who may not have medical training, who look to advocate for something that's not well evidence-based. And so certainly the providers are going to have some concerns until they understand who your resources are and what the training of that person is.
Well, it sounds like it's an approach that's in demand, Kara, would you say?
Yes, absolutely. The NIH has put out some interesting statistics that $34 billion a year is spent on complementary and alternative medicine.
Really?
And yes, and 40% of U.S. adults are using it. So the demand is real. I think that patients are seeking this for sure.
And how is integrative health program at UVM addressing that need and the growing evidence of the benefits?
So we have 3 arms of our program. We have a research arm, a clinical arm, and an education arm. We are partnering with the UVM Cancer Center and trying to develop some research around integrative healthcare. For our clinical initiative, we surveyed clinicians at the hospital, and clinicians, what we found is they are most interested in acupuncture, mindfulness, yoga, massage, and biofeedback. And what's great about that is those are all evidence-based modalities. So we feel really comfortable rolling those modalities out. So right now we're doing some pilots.
Okay, so let's talk a little bit about some of the specific types of complementary medicine and what are the benefits and possible risks there might be for cancer patients and survivors.
The biggest risk that I see in the incorporation of integrative therapies is when the information is not shared collaboratively. When a patient finds information and then doesn't share with his or her provider team the treatments that they've chosen. Generally, the therapies that are considered complementary therapies that are used in integrative medicine have a very high reward with a very low risk. That being said, anything we do has some degree of risk, and that should be managed and monitored. When we're thinking about mindfulness, meditation, gentle, brisk walking, those things have pretty low risk, and we can encourage them across the board. When we're looking to be more proactive and somebody wants to take a supplement, then we need to think about the risk. We need to think about the quality of the supplement. We need to think about the potency of the supplement. We need to think about whether that supplement's compatible with the current conventional medicines prescriptions.
Can you give me an example of what a supplement might be?
Sure. So some people will take herbs, for example. So a woman with a breast cancer diagnosis may take herbs that she's read about and heard about and maybe used through her pregnancy, and then may find that those herbs tasted good, felt good, she felt aligned with them. But some of those herbs are also estrogenic, and taking those with a breast cancer diagnosis now becomes very incompatible. So supplements that somebody would think of as herbal tinctures, vitamin D supplement is a pretty common and also potentially very valuable treatment. And then there are other high dose, complex, multiple formula products that certainly need some supervision.
Because I think people think if they're taking a supplement that's herbal or organic, that it's okay.
Yes, people do feel that way. And very many times someone can do that safely, but as soon as you have an oncology diagnosis, complex medical situation, I advocate for the more support, the better. The more people on your team helping you make that decision, the better off you're going to be.
And just to so UVM is partnering with the community, and we bring people like Amy in to our community practitioner forum so people can learn from each other, because the information's constantly changing.
And so how affordable are these kinds of resources, and are they covered by insurance?
Many of them are. Nutrition services are very useful in an integrative medicine model. Mental health support, mindfulness, meditation, these types of things are very well covered as part of people's health plans. Naturopathic physicians are covered by Vermont healthcare plans. Oftentimes acupuncture is covered. There are certainly therapies that are useful that are not covered, but we're looking to support patients, and many local hospitals have programs where support such as Reiki might be free and accessible to their patients, even though they're not covered by insurance.
And if folks don't know what that is, can you explain what that is?
Reiki, Reiki is an interesting type of considered an energy medicine where without specifically having contact, hand-to-body contact, there will be a supportive kind of healing space that patients find a great benefit from. Very relaxing, peaceful, encouraging, supportive care while they're receiving chemotherapy concurrently in some situations.
Mm-hmm. Yeah. Is this, it sounds like it's very important for the patient to really play a very active role in their recovery maintenance.
Mm-hmm. Mm-hmm. Being on the receiving end of a treatment is powerful, being well cared for by your team. But most patients come to the point where they actually want to be involved and they want to be directing some of their care, and it helps them to feel a powerful, healthy person. And to be really frank, most patients with cancer are really, really healthy people, and we need to be taking care of the part of them that's really healthy while the oncology team is treating the cancer.
Mm-hmm. Mm-hmm. And you know, we talked a little bit about this, but what about after your treatment is over with and you go forward and maybe you're a 5-year survivor or a 10-year survivor? Is this information still just as pertinent?
For some people, they feel healthy, they feel strong, they're ready to go on and leave the cancer diagnosis behind them. Other people want long-term support and supervision. Patients will be curious. As I mentioned earlier, people will think about diet, or they'll hear diet and nutrition, and the news often has new information that comes out, and the patient will say, I'm a 5-year survivor, I think I'm doing great, but do I need to know about this new information that I just heard about on the news? They'll check in with me. I'll help them discern what's valuable and what they can leave behind so that they can trust they're doing what's in their best interest moving forward.
So how can someone go about accessing these services?
So there's a few different ways. You should always talk to your physician, absolutely, number one, and try to get a referral. You could go onto our website, which is www.uvm.edu/medicine/PIH. It's a great resource with a lot of information. There's also a website, lauramanncenter.org, which has a directory of providers. So those are all great resources, which are listed on the UVM website.
And so you're both involved in an upcoming event hosted by the Vermont Cancer Survivor Network. Can you tell me a little bit about that?
Sure. So the event is on April 2nd. It's at the Vermont College of Fine Arts in Montpelier. It's free and it's open to the public. Our participants will include cancer survivors, family members, and caregivers, practitioners, both conventional and complementary and alternative, and the general public. The goal is to introduce participants to the variety of complementary and integrative medicine services available here in Vermont, and how they integrate with traditional medicine and what the benefits and/or risks may be. There'll be hands-on demos, workshops, lectures, and an exhibits fair, which will be more experiential. There'll be an art exhibit featuring the work of participants from Healing Arts and Writing, a program facilitated by Patricia Fontaine for individuals and caregivers faced with illness. And Amy will be providing our keynote lecture focused on inspiring patients to pursue collaborative integrative care. Providers from the UVM Cancer Center, UVM Health Network, Central Vermont Medical Center, along with community providers of various complementary and integrative medicine practices will also be presenting. We're very thankful to the Vermont Cancer Survivors Network for working so hard to bring this program to survivors, providers and the public.
And once again, that's Saturday, April 2nd in Montpelier. And if you want more information, there's a toll-free number. It's 800-652-5064. I want to thank you both for coming on today.
Thank you.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.